Topic: stereotypes and myth in counseling. So today, as a psychologist, I will be talking about what is counseling. What is counseling? Counseling is something which deals into real life situations. A counselor is a professional who know how to deal with people into a professional manner. When we are facing some problem, if we do not understand the actual problem behind that issue, we will not be able to face that problem. Counseling is a professional area where people deal with the clients in a professional setup through a professional method. Now, who is a counselor? As I told you, counselor is a professional person who deals with the clients and their issues in a very professional manner. I explain you with an example. Now, suppose you are suffering from diabetes. Okay. Now, what advice you are going to give to that person? First option is, the advice that you will give is, please take medicines that I am taking because I am also diabetic. Or you will say, please consult your friend who is a diabetic or know a little bit about diabetes. Or you are going to say that person, no, diabetes is a very important problem, physical health problem. You need to consult the doctor. Don't listen to others' advices. Go for a proper testing, and with that result, go to the doctor and take proper medication. Whatever steps that doctor asks you to, you need to go and follow that. So in that case, you are giving advice, you are giving a right advice. So why in today's time we are not taking mental health as a serious problem? Mental health is also like our physical health. We need to be very, very serious about our health problems. If you are not healthy from your mind, if you are not healthy from your thinking process, if you are not healthy with your positive attitude, you won't be able to achieve your goals. You won't be able to do your daily problems. You won't be able to do your daily things because you are stressed. You are mentally upset. So, mental problem plays a very important role in our today's life. If you are facing any kind of issues related to mental issues, you need to consult a counselor. Now, what are those mental issues? They can be any mental issue: stress, depression, or it can be day-to-day issues, relationships, arguments, phobia, motivation. You are not motivated. Why you are not motivated? Many people come to me and say, ma'am, I have the capability to work, but when I move towards working that area, I feel lethargic. I don't want it to do. मेरे में वो जोश ही नहीं है काम करने का. मेरे मन का काम है वो, मैं उस काम को करना चाहता हूं लेकिन मैं नहीं कर पाता. मेरे में वो जोश ही नहीं है. जब मैं करने बैठता हूं मेरा माइंड डाइवर्ट होता चला जाता है. मैं सोच रहा हूं छोड़ो, बहुत बोरिंग हो गया, लेट्स मूव टू समथिंग एल्स. देन आई स्टार्ट समथिंग एल्स विद फुल जोश, with full power, full energy. Again, after some time, I feel lethargic. I don't want to do all these things. Where is the motivation? Why the person is not motivated? Why? Because you are having some mental issue. कोई एक ऐसी चीज जरूर है जो आपको कहीं ना कहीं मेंटली परेशान कर रही है. क्या है वो चीज? हम क्या करेंगे? अपने दोस्त से बात करेंगे. आपका दोस्त कहेगा, हाँ यार मेरे साथ भी ऐसे कभी ना कभी होता है, मैं तो क्या कहता है सोने चला जाता हूँ या अपना माइंड डाइवर्ट कर लेता हूँ, म्यूजिक सुन लेता हूँ. XYZ रीजन आपका फ्रेंड देगा. फिर आप अपने कलीग के पास जाओगे, यार मेरा ना बहुत मन है ये काम करने का लेकिन मैं कर नहीं पा रहा, मैं क्या करूं? हाँ यार मैं भी ना कभी कभी बहुत बोर हो जाता हूँ, मैं तो छुट्टी लेके घूमने चला जाता हूँ, माइंड फ्रेश हो जाता है, फिर मैं आके अपना काम करना शुरू कर देता हूँ. इस तरीके से आपको कोई ना कोई एक्सपीरियंस आपके कलीग्स, आपके फ्रेंड्स या आपके फैमिली मेंबर्स देंगे. लेकिन वो जो दे रहे हैं वो अपने पर्सनल एक्सपीरियंसेस से दे रहे हैं, जो उनके साथ हुआ, उन्होंने जो स्टेप्स लिए, शायद सक्सेसफुल हुए, शायद सक्सेसफुल नहीं हुए, आपको नहीं पता उनने, या कई बार आपको लोग दिखाएंगे कि देखो मैं कितना इंटेलिजेंट हूं, XYZ आपको बताते चले जाएंगे, तो आप उस चीज को फॉलो करते जाओगे, तो आप क्या करोगे, आप भी वो फॉलो करोगे। बट you need to understand every individual is a different individual. What is suitable for me is not suitable for my cousin maybe, or for my real brother, or maybe for my daughter or my son, because I am an individual and that person is an individual. मेरी अपनी कैपेबिलिटीज हैं, सामने वाले की अपनी कैपेबिलिटीज हैं, तो ऐसे टाइम पे हमें क्या करना है, हमें एक प्रोफेशनल हेल्प लेनी है। वी नीड टू हैव अ वेरी प्रोफेशनल हेल्प, एंड दैट इज विल बी टेकन ओनली फ्रॉम योर काउंसलर और अ साइकोलॉजिस्ट। सो इन टूडेज सिनेरियो, व्हाई वी विल नाउ पीपल से आजकल पता नहीं क्या प्रॉब्लम है, काउंसलर की जरूरत है, काउंसलर की जरूरत है। पहले तो ऐसा कभी नहीं होता था, कोई काउंसलर की जरूरत नहीं होती थी। वी नीड टू अंडरस्टैंड the scenario from 19th century has totally changed into 21st century. In earlier days, people used to live in big family-oriented houses. Joint families were there, 20, 25 members were living together, kids were there, and everyone was knitted closely with each other. Today, that has gone down. Everyone is very, very busy in their own personal life. Nobody is concerned about other person. Earlier, neighbors used to be like family, but today, on a real basis, what happens? We even don't know who is living in our neighbor. Why? Because every individual is now alone, and everyone says, I need my personal space. I need my personal space. But sometimes we are so lonely that we don't have anyone to discuss with. Here comes the role of the counselor. When we are alone, when we are not able to face the issues that we are going through, we don't know what is happening with me. I don't know why I am not feeling happy. I don't know why I am not able to, do things that are there. So, what is going to happen? You need help. And who is the right person to help you is a counselor, because counselor is one person who is going to deal with your issues in a more prominent way, in a more professional way. He is not going to give you vague answers just on the basis of experiences, or what my ancestors used to do, or what my dadaji used to do, or what my son used to do. No. Mental issues need to be taken very, very seriously in today's time, because if mental issues increases, it can lead to very devastating results, which is one of the most devastating result is suicide. Now, many a times you have seen teenagers, especially from the age of 16 to 18 or 20, they commit suicide. Why do they commit suicide? Because of the interaction problem. Many of them says, my parents don't understand what I want. They don't wanted to know what I want. They just, say, okay, do this, do that. You have to take this career, you have to become this. What I want, they don't understand. On the other hand, parents have their own stigmas. No, my child, he's too young. He's not able to take the decision. How can I leave things on them? So these understanding issues, we are not able to understand each other's perceptions. So these are the major issues. Then what we will do is we will collect 2-3 people of the family and we will continue. So everyone will talk according to their own experiences or what they have done in their own life. लेकिन आज के टाइम में जो एक आज नया डेवलपमेंट है बच्चे के अंदर, जो एक नई अपकमिंग प्रोग्रेसेस है, वो बच्चे को पता है. तो एट दैट टाइम इट्स वेरी वेरी इंपॉर्टेंट दैट यू नीड टू have your own understanding and your broaden up your prospectum. That helps a counselor. There comes the role of the counselor. Counselors sometimes also work as a bridge between the communication between the child and the parent. So we really need to have a counseling whenever we are facing any mental issue and if it is not under our control. Sometimes we say people are not very active, and I don't know, from a month or so that person has really gone into a shell, is not sharing anything, is not talking about anything. Why? People will say ऐसी मन नहीं होगा, अंदर से तबीयत ठीक नहीं होगी, उसको अच्छा नहीं लग रहा, कोई बात नहीं, थोड़ा चेंज होने दो. Really? No. Maybe this misconception can lead a dangerous step in that person's life. We need to find out what is the actual problem behind that person. Why that person who was so active, who was so energetic, who was so creative, have gone into that shell. We need to break those stigmas, old stereotypes. कि नहीं ऐसी हुआ होगा, कुछ नहीं होता, वो ठीक हो जाए. नहीं होगा. That person needs a professional help. That needs a professional help. So the way you advise your family members and your friends when there is a physical health issue, similarly you need to advise your friend and your family members to consult a counselor and take counseling sessions so that that person can live a more positive and more active life and can achieve his and her goals. Now, what does a counselor do? What is the role of the counselor? Now, suppose you say, okay, I have a problem, I will go for a session, but you are confused what a counselor is going to do. The counselor will help you by your own perception and your own understanding. That what are your strengths, what are your weaknesses, why you are into this stage. He will take a very deep understanding of your problem. He will go into depth of that problem. When does it started? Why does it started? What are the other areas that are events that are affecting that area? All those informations will be gathered by the counselor, and then on the basis of those information, the counselor will talk to you on the current scenario. Counselor, how do counseling starts is when you go to a counselor will first you will make a good rapport with the counselor. Then a counselor will take a deep history of your life, of your behavior, your attitude, your personality, your likes, dislikes, your strengths, your weaknesses. All those areas will be talked about by the counselor. Then after that, the two major things, trust building and confidentiality. These are the two main areas where the counselor have to be very particular, as well as the client. Confidentiality, that what the client and the counselor is talking should be between them only. Whatever information is given by the client, because it is very personal to that person, it is very touchy area of that person. That's why that person is not opening up so easily. So that person needs time. So counselor have to give time to that person. And then slowly and steadily, depending on the sessions and comfort zone of the client, the session goes on. Counselor will not talk about or will not give solutions on the basis of his personal experiences like other people. मेरे साथ ये हुआ था, मैंने तो ये ट्राई किया था, आप ऐसे ट्राई कर लो. No. Counselor will talk on facts, on therapies which are helpful in one's life to come out from major mental issues. Second myth, counselor guide करता है. Counselor बताएगा ऐसे करना है, वैसे करना है. नहीं. No. Counselor does not give guidance. Counselor helps you to find out solutions through the various opportunities or abilities the person have inside him. Counselor never say, do this, don't do that, do this, don't do that. No. Counselor will make you aware about your own abilities, about your own strengths, where you are capable, where you are not capable, what is real, what is unreal, these picture will be made clear in front of the client by the counselor. Second most important myth, judgment. No counselor makes any judgment. Judgment is not the work of the counselor. Whatever the person is feeling is nothing wrong or right. It's your personal feeling. Anyone can have that feeling. No one is judging you when you are talking. So never ever think, if I go and share my problem or my feelings or whatever I'm going through, the person, a counselor, will judge. Counselor will never judge. For a counselor, each problem is as important as any other problem. No problem is small or big for a counselor. Every problem has an equal weightage for a counselor. So whenever you go and talk to a counselor, he or she will take it as seriously, as sensitive as you feel. So this is the second myth that people have about counselors. The third myth, which has been created by these B schools and colleges and other private institutions. Whenever you get a call from these areas or from hospitality or somewhere else, they will say that our counselor will talk to you. Now that's not a counselor. That's not a clinical counselor. That person is only promoting his or her area where he is working. His maybe a college, maybe an institute, maybe some other organization. That counselor is only talking about the benefits that you will get from that organization so that you get connected with them. So please be very clear that counselor is a very different person. Counselor is one who deals with your mental problems, deals with your mental issues through therapies, through other methods that need to be there, that need to be solved by you. And counselor is one who is going to help you in your daily problems. Now I'll talk about what problems are being taken up by the counselor. I have earlier told you also, a counselor talks about anxiety, relationship problems, peer pressure, adolescence issues, teenager issues, old age problem. Some people, when they they have now old age problems, what old age at the age of in old age also people face a lot of mental trauma. Why? Because till the time they were not retired, they have a very busy and a proper schedule of their life. Once they get retired, their total schedule changes. Sometimes this change in your schedule, that now you don't have any responsibility, now you don't have to get up and go, you don't have a proper routine, you don't have any power in your hand, now you have to just sit at home and be at home and nothing to do. These things can also create a trauma in a person. So this is also related to your mental health. So all these kinds of problems and the problems that you face in your day-to-day life, stress, motivation, lethargic, you don't want to do something, why you feel irritated from inside, frustration, anger, why anger is increasing again and again, behavioral issues, acceptance in behavior, all these areas are dwelt by the counselor. Now there's a difference between, you have also heard the word psychiatrist. Now what is the difference between a counselor Now, what is the difference is, the biggest difference between the psychiatrist and a psychologist or a clinical counselor is that a psychiatrist is a person who can advise you medication. Like you take medicines for diabetes and other problems. Similarly, for mental issues also, when the mental issues severity increases, there are some mental disorders and some mental issues, when they go into severity, you really need to have medication to bring your mental state little lower. And along with that, your therapies will go on, which a counselor will be taking. Counselor will never ever advise you medication. They will never ever advise you medication. But yes, if you go to a counselor and on the basis of your information and history and the current scenario, if the counselor feels that the area, that the problem that you are facing needs medication to be settled down along with the therapies, then yes, the counselor can recommend you to the psychiatrist. So we have a very big line which is very prominent is लोग क्या कहेंगे. अगर मैं काउंसलर के पास गया, सेशंस लेने के लिए गया, तो लोग क्या कहेंगे? लोग सोचेंगे मैं पागल हूं, मेरे साथ कुछ प्रॉब्लम है, मैं मेंटली स्टेबल नहीं हूं. नहीं, ऐसा नहीं है. हमारे दिमाग में ये जो एक स्टीरियोटाइप बिठा दिया गया है कि लोग बातें करेंगे, नहीं 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 नहीं, काउंसलर के पास मत जाना, लोग क्या सोचेंगे, अरे कोई बहुत बड़ी प्रॉब्लम थोड़ी ना है, तो छोटी मोटी प्रॉब्लम्स है, आती रहती हैं लाइफ में, इट्स ओके, तुम थोड़ा चेंज ले लो, तुम ये ले लो, तुम इससे बात कर लो, तुम अपनी लाइफ में थोड़ा सा चेंजेस ले आओ, रूटीन सेट कर लो, खाना अच्छा. नो, दिस इज जस्ट अ स्टीरियोटाइप. लोग कुछ नहीं कहेंगे. क्यों? क्योंकि अगर आप अपनी लाइफ को एक स्मूथ वे में नहीं कर पा रहे हो, एक स्मूथ लाइफ नहीं रन कर पा रहे हो, तो लोगों को इससे कोई वो प्रॉब्लम नहीं है. प्रॉब्लम आपको होगी, आप अपने गोल्स को अचीव नहीं कर पाओगे. सो प्लीज रिमूव दिस स्टिग्मा. लोग क्या कहेंगे? लोग कुछ नहीं कहेंगे. यू नीड टू टेक केयर ऑफ योर ओन मेंटल हेल्थ. If your mental health is not proper, you won't be able to, if you are not able to do your normal daily routines, you are feeling depressed, you are not energetic, you are shouting at home, your relationships are getting disturbed, then it is the thing that is really really serious and you really need to meet a counselor. So my today, why I am here, my purpose of being here is to tell you that yes, counseling is very very important in today's life. If you are going through any mental issues, please consult your counselor. It is really really important. And I really thank Ansh Foundation, which is a charitable organization which has been working on these sensitive issues to bring human life more comfortable, have given me this opportunity to get touch with you all through their platform and make these stereotypes and myths remove from your minds that counseling is not a wrong thing. Counseling is something which is going to help you in your daily life to be more strong mentally, to be more positive in your life. We all go through these areas. We all go through various problems, stress, depression, minimum depressions, all those things. But if we get the right place, if we get the right guidance, if we get the right help at the right time, we can focus on our life and we are able to achieve what we want in our life. No one can stop us. But for that, we need to be very, very healthy, very, very healthy, mentally as well as physically. If you are a very strong person but you are not mentally fit, you won't be able to achieve anything because you will not feel like doing it. Your motivation will not be there. You will not be energetic. You will feel low. So that is why I'm saying, please do not hesitate if you need a help. You have to be very, very prompt to adopt for counseling. Please advise people openly if you feel that person needs a professional help. Don't go into misguidance or stereotypes of people. नहीं, कुछ नहीं होता, ये तो कोई प्रॉब्लम ही नहीं है, क्या हो गया, थोड़ा सा अंदर से लो लग रहा है, तो सबको लगता है. If it is not regular, then maybe. But if these things are prominent in your daily life routine, if these problems are creating problem in, having a normal life, also normal routine life problems also you're not able to deal with, then yes, you need help, you need a professional help. So I hope most of your doubts are being cleared today from me